Asthma for structure and function of the human body. Asthma is a disease that is described as a breathing disorder generally caused by inflammation in the bronchial tubes. Inflammation can be caused by abnormally narrow bronchial tubes, inflammation due to a trigger, excessive mucus production, or a combination of these factors. Triggers vary from person to person but can include airborne allergens such as pollen, animal dander, or mold, respiratory infections, strenuous activity, cold air pollutants, some medications, stress, sulfites, preservatives found in certain foods or beverages, and gastroesophageal reflux disease, or GERD. Some asthma sufferers can go long periods of time without an incident and only suffer from infrequent flare-ups, which are called asthma attacks. Others experience the symptoms every day. Asthma severity ranges from person to person and sometimes from attack to attack. There are numerous signs and warnings to consider. For a moderate attack, the symptoms are an SpO2 that is greater than or equal to 92%, the ability to talk, and a PEFR that is greater than or equal to 50%, best or predicted. For a severe asthma attack, the symptoms are an SpO2 that's less than 92%, too breathless to talk, obvious accessory neck muscle use, and PEFR between 33 and 50%, best or predicted. For a life-threatening attack, the symptoms are an SpO2 that is less than 92% plus any of the following symptoms: poor respiratory effort, exhaustion, agitation, altered consciousness, cyanosis, silent chest, and a PEFR that is less than 33%, best or predicted. The process of an asthmatic episode is as follows. It begins with inflammation triggered by one or a few various triggers. Airways continue to swell. Muscles around airways begin to constrict. Cells inside airways begin to secrete more mucus. Airflow to lungs begins to lessen. Difficulty breathing and wheezing. Early detection is a key factor in management. Some of these early symptoms can include shortness of breath, chest tightness, wheezing or coughing while under physical strain, fatigue, and frequent coughing. Without proper treatment, symptoms can become more severe, causing the inability to speak, cyanosis, which is the bluish coloring around lips caused by oxygen levels dropping in the bloodstream, loss of consciousness, and even death. The body systems affected by asthma are the respiratory system, the immune system, and the nervous system. With the respiratory system of an asthmatic, it's more sensitive. During an attack, the airways narrow, which makes it more difficult to breathe. Asthma can cause your immune system to respond sensitively to substances that would be harmless to those without asthma. A nerve growth factor, a nervous system protein, has been found to increase sensitivity to irritants among those suffering asthma and allergies. The long-term effects of asthma depend on the triggers that cause the attacks. For exercise-induced asthma, it can lead to a sedentary lifestyle. Sedentary lifestyle leads to higher rates of obesity, diabetes, and high blood pressure. Other long-term effects of asthma are that lung tissue can be replaced with scar tissue, which can sometimes lead to severe lung damage. Excessive mucus production in lungs can lead to a higher chance of developing additional diseases, such as pneumonia and bronchitis. And antibiotic resistance to respiratory infection medication is also a long-term effect. Asthma manifestation in children. Asthma can occur as early as birth or can manifest later in life. For children, the first symptoms often occur before age 5. Children are not always diagnosed right away because asthma can be hard to detect in young children. Asthma in children is generally detected by wheezing. Another key factor is whether or not the parents also have asthma and if the child has allergic reactions. If the child's wheezing happens at times other than during a cold or infection, this is also a symptom. Testing for asthma in adults is a little bit easier as doctors can use several tests. Spirometry determines the lung capacity and whether or not the patient appears to have difficulty performing the test. Bronchoprovocation measures the sensitivity of the airways, and allergy tests determine any triggers that may be causing breathing difficulties. There is no prevention from contracting the disease, but there are precautions to decrease the frequency and severity of the attacks. Become familiar with triggers. Avoid known triggers, and have a plan in place in order to stop an attack as soon as possible. Having an asthma action plan is important, as it is important to understand which medication to take and the appropriate dosage, and also when to contact the doctor or seek help at an emergency room. Even with well thought out planning and carefully following prevention steps, attacks are inevitable. Drug therapy is the most effective treatment for an asthma attack. Drug therapy can be categorized as long-term control and quick relief. For long-term control, there is inhaled corticosteroids, long-acting beta agonists, leukotriene modifiers, theophylline, and combining ICS and LABA medications. For quick relief, there is short-acting beta agonists such as albuterol and anticholinergics. For non-medicinal treatments, one of the treatments is taking a deep breath through the nose, taking a drink of cold water, and then exhaling through the mouth, and repeating this process. With this method, taking slow and paced breaths can help to lessen the severity of the attack. The water is there merely to assist in breath control and calming. Another non-medicinal treatment is sitting in a closed room with hot water running. This causes steam to fill the room, which can help loosen mucus that may cause inflammation of the bronchial tubes.